You've got people flying in from all across the globe to see you all.
Yes, yes. And one of the procedures that we do that we've become very successful and known around the world for is hand vein removal.
Okay.
He really closes them down. We don't remove them. He closes the veins down and the body absorbs them. But we're being very successful because there's not a whole lot of people that are doing hand veins. A lot of people are doing fillers, and that's repetitive. And then it doesn't give you a smooth look because you have these filler things in there. So we close the veins down. And I had my veins done because hand veins are a sign of age. And when I learned that hand veins were a sign of age, oh no, it was driving me crazy. I was like, Chris, you have to do my veins. Chris, you have to do my hand veins, especially when you're driving and you see your hand veins on the wheel. And then when you're going to parties and you're holding your cocktails, the hand veins, you can look great in the face. You can be physically fit.
I think that's just something you women notice. Us men really don't pay attention to that.
Dr. Chris Pittman, he, all the time he says that we could like lose a leg and be like, I'm fine, I'll walk it off. But you're on camera, so I mean, why don't you hold your hands up towards the camera so the people watching the stream can see the results of
very beautiful hands,
the good doctor's work. Yeah.
Oh gosh.
And it's actually a good opportunity to ask you a little bit more about the experiences of going through the procedures and stuff like that, being that, I mean, Doc is on all the time talking about vein care and stuff.
Yeah.
I mean, we don't have the opportunity to actually talk to a patient, let alone his wife. So if you want to go ahead and describe the process, we'd appreciate it.
Sure, let's hear.
I just put my hands, you put your hands on a pillow and he injects them and then they close down and he wraps them. You keep your hands up for a couple of hours.
And the total time that this takes?
Well, when he does the injections, which do not hurt because the injections are smaller than a hair follicle, the needle. So you really don't hurt. And believe me, if he hurt me, he would know about it.
Right.
So you keep your hands up and for a little, for a couple of hours, and then
that's
see
probably the
veins
most
close
challenging
down.
part of the process, right? Holding the hands up, right?
Yeah.
Do they put you in some type of apparatus to help you hold the hands up?
He has this little
movie
thing that he wraps around your hands. Nothing obtrusive, you just wrap, and then you keep your hands up, and you see what veins close down. And in a couple of weeks, you come back, and if there's anything that didn't close down, he injects those, and it takes about 2 or 3 times.
Yeah. And so
and then
they're
he
gone.
closes them down, and you
they've
look
not
good,
come
and
back
you can
or anything.
hold wine glasses and not worry about looking old. So now you can know that it's an indicator of getting old.
Yeah,
You're gonna
now
look, you're
you
gonna tell
draw
age.
my
Like,
attention.
okay.
So now I'm going to be looking at all the women's hands today. I'm like, all right, you need to go see Dr. Pittman.
yeah.